Did you know your skin can be a window into your liver health? It's true. Your skin often reflects what's happening inside your body. In this video, we'll explore 10 skin signs that could indicate a problem with your liver. Recognizing these signs early can be crucial for timely diagnosis and treatment. Welcome to Lumilix Health, where we empower you to take control of your well-being. We believe that knowledge is power, especially when it comes to your health. The liver is a powerhouse organ, playing a vital role in keeping you healthy. It's responsible for so much, often working silently behind the scenes. One of the liver's most important jobs is detoxification. It filters harmful substances from your blood, protecting you from toxins. The liver also plays a crucial role in metabolism. It processes nutrients from the food you eat, converting them into energy and essential building blocks. Beyond detoxification and metabolism, the liver performs many other vital functions. It produces proteins, stores vitamins, and helps regulate hormones. When the liver isn't functioning properly, it can have a ripple effect throughout your entire body. This can manifest in various ways, including changes in your skin. Now, let's dive into the 10 skin signs that could indicate a liver problem. For each sign, we'll cover its description, explanation, severity, and what action you should take. Jaundice is a yellowing of the skin and the whites of the eyes. It's one of the most recognizable signs of liver disease. This yellowing occurs due to a buildup of bilirubin in the blood. Bilirubin is a yellow pigment produced when red blood cells break down, and the liver normally processes it. Number 1. Jaundice can range in severity, from mild to severe, depending on the underlying cause and the extent of liver damage. It's always a sign that something is not right. If you notice yellowing of your skin or eyes, it's essential to consult a doctor immediately. Jaundice requires prompt medical evaluation to determine the cause and appropriate treatment. Number 2. Persistent, widespread itching, also known as pruritus, can be a frustrating symptom of liver disease. It can affect your entire body and significantly impact your quality of life. The exact connection between liver disease and itching isn't fully understood. However, it's believed to be related to the buildup of bile salts under the skin. The severity of itching can vary greatly. Some people experience mild itching, while others suffer from intense, debilitating itching that disrupts sleep and daily activities. Number 3. Spider angiomas are small, red, spider-like blood vessels that appear on the skin. They're characterized by a central red spot with radiating capillaries resembling spider legs. These angiomas are thought to be caused by hormonal imbalances associated with liver disease. The liver plays a role in regulating hormones, and liver dysfunction can disrupt this balance. While spider angiomas are often harmless, their presence can indicate underlying liver problems. They are more common in people with chronic liver conditions. Number 4. Palmar erythema is a redness of the palms of the hands. The redness is usually most prominent on the outer edges of the palms and the fingertips. The exact cause of palmar erythema and liver disease is not fully understood. It's thought to be related to hormonal changes and vasodilation, or widening of blood vessels. Palmar erythema is generally not painful or itchy. However, it can be a noticeable sign of underlying liver problems. If you notice persistent redness of your palms, especially if it's accompanied by other symptoms, consult a doctor. They can evaluate your liver health and determine the cause of the redness. Number 5. Xanthelasma are yellowish plaques that appear around the eyelids. These plaques are composed of cholesterol deposits. While xanthelasma are often associated with high cholesterol levels, they can also be a sign of liver disease. The liver plays a role in cholesterol metabolism. Xanthelasma are generally harmless and don't cause any symptoms. However, they can be cosmetically bothersome for some people. If you develop xanthelasma, it's a good idea to consult a doctor. They can assess your cholesterol levels and evaluate your liver health. Number 6. Clubbing of the fingers is an enlargement of the fingertips and a change in the angle of the nail bed. The fingertips become rounded and bulbous. Clubbing is often associated with chronic lung disease, but it can also be a sign of liver disease, particularly cirrhosis. The exact mechanism is not fully understood. Clubbing develops gradually over time. It's usually painless, but it can be a sign of a serious underlying condition. If you notice clubbing of your fingers, it's important to consult a doctor. They can investigate the cause and recommend appropriate treatment. Number 7. Changes in nail appearance, such as white nails, Terry's nails, or other abnormalities, can be associated with liver disease. Terry's nails are characterized by a white or pale nail bed with a narrow band of pink or brown at the tip. These nail changes are thought to be related to changes in blood flow and nutrient supply to the nail bed. Liver disease can disrupt these processes. If you notice significant changes in your nail appearance, especially if they're accompanied by other symptoms, consult a doctor. They can evaluate your liver health and determine the cause of the nail changes. Number 8. Bruising easily, or experiencing excessive bruising from minor injuries, can be a sign of liver disease. This is due to impaired blood clotting. The liver produces many of the proteins involved in blood clotting. When the liver is damaged, it may not be able to produce enough of these proteins. As a result, people with liver disease may bruise more easily and experience prolonged bleeding from cuts or injuries. Even minor bumps can result in large bruises. If you notice that you're bruising easily, especially if it's accompanied by other symptoms, consult a doctor. They can assess your liver function and evaluate your blood clotting ability. Number 9. Dark urine, which appears darker than normal, can be a sign of bilirubin in the urine. Bilirubin is a yellow pigment that's normally processed by the liver. When the liver isn't functioning properly, bilirubin can build up in the blood and be excreted in the urine, causing it to darken. The urine may appear brown or tea-colored. Dark urine can also be caused by dehydration or certain medications. However, if it's accompanied by other symptoms, it could be a sign of liver disease. If you notice that your urine is consistently darker than normal, consult a doctor. They can investigate the cause and determine if it's related to liver problems. Number 10. Edema is swelling, especially in the legs and ankles. It's caused by fluid retention in the tissues. Edema can be a sign of liver disease, particularly cirrhosis. The liver produces albumin, a protein that helps keep fluid in the blood vessels. When the liver is damaged, it may not be able to produce enough albumin. This can lead to fluid leaking out of the blood vessels and into the surrounding tissues, causing swelling. If you notice swelling in your legs and ankles, especially if it's accompanied by other symptoms, consult a doctor. They can evaluate your liver health and determine the cause of the edema. It's important to remember that this video is for informational purposes only. The information provided should not be considered medical advice. If you're concerned about your liver health or experiencing any of these skin signs, it's essential to consult a doctor for diagnosis and treatment. And if you want a supplement to help support your liver health, you can click the link in the description below. Thank you for watching.